Across America, rural communities are facing a growing healthcare crisis, one defined by expanding medical deserts. These are regions where residents have limited or no access to essential services, including primary care, emergency medicine, and specialty care. With vast geography, diverse populations, and limited resources, rural healthcare systems must take bold and innovative approaches and recruit highly skilled professionals to meet the needs of the communities they serve.
So we support communities made up of populations of older Americans, frequently agricultural communities, people who work hard for a living and sometimes have chronic diseases, whether it's heart disease or cancer, diabetes. Rural healthcare services in these communities can support these populations, keep them healthy, and manage those disease processes before they get into real trouble and end up in acute care services in larger communities. There's actually a lot of barrier to providing rural health care in the United States. Rural health systems struggle with worker shortages. Very many of these small communities, it's hard to find trained nurses, techs, doctors. Many times physicians don't have an interest in being in some of these very small communities. It's just a matter of time before you run out of resources and start closing services and ultimately closing the entire system. And that's a huge problem because in the absence of a rural healthcare system, the patients in those communities are now forced into the urban settings far from home, and they actually displace the patients who would otherwise be in those systems. And so it's not just about rural healthcare. It actually becomes about all the rest of the healthcare system. All those patients still need to be taken care of, except now they're being taken care of in fewer sites. And those fewer sites have much less capacity now. And so it creates an access problem all around. I think that's what could happen as we continue on this trajectory.
The largest nonprofit healthcare system in Eastern Washington, Astria Health provides a broad range of acute and community-based services to the rural and underserved populations of the lower Yakima Valley. Through hospitals, outpatient health centers, and a highly skilled team of surgeons and specialists with strong clinical outcomes, Astria Health delivers trusted, high-quality care close to home, regardless of income, ethnicity, or zip code.
As we began developing our care system, we focused a great deal of energy on providing primary care services, family practice, internal medicine physicians, family practice nurse practitioners, people who could take care of basic everyday coughs, colds, and recognize diagnostic challenges that our patients were having. And so today we have brought on orthopedic surgery, general surgery, we have cancer care, ear, nose, and throat surgery. We do neurosurgery. We have 3 neurosurgeons in our community. We provide all kinds of high levels of care in very small communities. We take care of our patients. One of the things that we're working on is trying to tie behavioral health services into our primary care clinics. So a patient comes in for a cough or cold, they may have some depression matter going on as well. And as a result, our patients don't have to travel. Care is much better, and we provide great services in a very small community.
A treatment philosophy for me, but I also see this in the entire organization here, is to really focus primarily on patient care. We have the time to do it, and we also have the resources to do it. And for me, it's very important to treat people as I want to be treated. I always think of me as if I was the patient or as a family member was the patient, and make decisions according to that. I perform all spine-related procedures, so I treat every spine condition that needs surgical attention. I'm very careful with what requires a surgical procedure and what doesn't. Most conditions do not require surgical intervention. Most can be treated conservatively. For those that do need a surgical intervention, me and my team, we cover everything. So it's really from the upper cervical spine to the lower lumbar spine, including the SI joint. We treat a lot of spine joint-related problems. Mostly what we treat are degenerative problems because that's most common in the population, but we also treat spine trauma, covering the entire spectrum of spine-related care. We also are often confronted with head trauma, so brain bleeds, skull injuries. Those are patients that we handle here out of the emergency room.
The impact that all of our providers have is immeasurable. And because of our valley and where we live, it's extremely visible to see the day-to-day difference you make. Something as small as coming in and seeing a child, getting that child a sports physical so that they're able to go and participate and have that safe space to be after school, which some of our residents don't always have. To be able to provide that access and a safe space for our children is a wonderful thing to be able to be a part of. Our patients are having to work really long, hard hours, 6-7 days a week sometimes. Getting away to go to a doctor's appointment, even if I'm hurting, even if I'm sick, it can be a struggle and it can really affect their life. It's not just, oh, it's a quick appointment, right? So how can we meet our patients where they need to be? The majority of our providers travel to various locations. We have clinics and satellite sites all through the valley. They travel to help best meet their patients. So it's a little bit easier to get it even closer, even within inside our small community. How can we make it easier, more accessible?
Well, I ended up with some significant back problems as a result of 30 years in the fire service. Numerous incidents over the years caused damage to my back, my spine. I ended up with a referral to Astria Health and neurosurgeon Dr. Peter Grunert. The care he's provided has been top-notch. He is unbelievable. His knowledge, his background, his compassion, his care has been exemplary from day one. Had I not received the care that I've received through Astria Health and Dr. Grunert, I would not be walking today.
The future of Astria Health is guided by one single goal, and that is a commitment to providing continuing care for our community now and for generations to come. We continue to grow outside the hospital walls, including dentistry, home health services, many of our therapies, pediatric services, such that we can continue to create that generational care going forward.
Every community, no matter how small, deserves access to quality health care. Learn more about Astria Health. Exceptional rural health care close to home.